The Black Death, also known as the bubonic plague, was one of the deadliest pandemics in human history. It swept through Europe in the 14th century, causing widespread death and devastation. The exact origins of the Black Death are still debated among historians, but it is believed to have originated in Central Asia and spread to Europe through trade routes. The Black Death is thought to have arrived in Europe in 1347, when Genoese traders returning from the Black Sea port of Kaffa brought the disease with them. The disease was caused by the bacterium Yersinia pestis, which was transmitted to humans through the bites of infected fleas that lived on rats. Once infected, individuals would develop symptoms such as fever, chills, weakness, and the formation of painful swollen lymph nodes called buboes. In some cases, the disease progressed to cause severe respiratory symptoms, leading to death within days. The Black Death spread rapidly through Europe, facilitated by the dense populations of cities and the lack of understanding of how the disease was transmitted. The unsanitary conditions at the time also contributed to the rapid spread of the disease. It is estimated that the Black Death killed between 75 to 200 million people in Europe, resulting in the deaths of up to 60% of the population in some regions. The impact of the Black Death on European society was profound. The high mortality rates led to labor shortages, which in turn resulted in economic disruption and social upheaval. The feudal system, which had been the dominant form of social organization in Europe, began to break down as peasants demanded higher wages and better working conditions. The church, which was seen as powerless to stop the spread of the disease, also suffered a loss of credibility and influence. Despite the devastation caused by the Black Death, the pandemic had some long-term positive effects on European society. The labor shortages caused by the high mortality rates led to an increase in wages for workers, as employers competed for scarce labor. This shift in economic power helped to lay the groundwork for the eventual decline of the feudal system and the rise of capitalism. The Black Death also had a lasting impact on medicine and public health. The pandemic led to advances in the understanding of infectious diseases and the development of quarantine measures to prevent the spread of disease. The experience of the Black Death also led to a greater emphasis on sanitation and hygiene in European cities, which helped to reduce the incidence of infectious diseases in the centuries that followed. The Black Death was a catastrophic event that had far-reaching consequences for European society. It caused widespread death and suffering, but it also led to social, economic, and medical changes that helped to shape the future of Europe. The lessons learned from the Black Death continue to inform our understanding of pandemics and the importance of public health measures in controlling the spread of infectious diseases.